Or even in your Western diagnosis, you learn that in your Western diagnosis.
No, we didn't see it.
Neurogenic claudication.
Neurogenic.
Neurogenic. Neurogenic claudication. And then the other one is vascular claudication.
We didn't see this with Dr. Long.
Hmm?
No.
In the
Western
I don't
case
see.
first week,
In my notes for the first week, I didn't see this one. Honestly.
Yeah, we don't have it. Not even in trauma as well. The names sound very unfamiliar.
Vertebrae, scapular behind the leg. How to locate.
Okay.
Couple things. No.
go into the lumbar, nearby the lumbar.
No, the first
week, but
first week we were doing
All the
kind of,
conditions.
yeah.
I go from the list. Remember the list?
yeah, and then but we went randomly.
Where the lumbar part?
This is the cervical.
Where we talk about the lumbar, all the facet, lumbar facet, muscle strain, QL strain.
Let me see this
Should be
one,
lumbar.
this one. Lower back.
Reflex.
L4, L5.
Other
S1.
reflex. How about the
That's-
seat? Did you have the seat that I gave it to you guys?
Yes, we have that one.
Yeah, open it.
Just a second. Let me see. Mine is like everything is here. I think it should be here. Oh, it's not there.
Remember the list, all the conditions?
Yeah, I know the list, and we have it for sure. I
what list?
I don't have it here.
What list?
The list that he gave it to us through
Yeah,
the
all
Google
the tests.
Classroom. List of the tests and
Yeah.
and all the
And the
diseases, conditions.
Yeah.
You have it here?
I know, but I have it here.
I give it in the. I put in the.
Yeah.
On the
Google
Google
Classroom.
Class, yeah. You can print it out. Yeah, she have it
Yeah, I
here.
have one.
Yeah, good.
Because we reviewed it for
Claudication.
So, so Dr. Friend, do you think we have those conditions in this guy? With this guy here?
I can tell you. You think about it. Differentiate between neurogenic
Yeah,
claudication.
vascular.
Oh.
Differentiate neurogenic claudication.
Yeah, but we don't talk about it yet, right?
Huh? No?
Okay.
Yeah.
Well, let's.
Yeah, I think it's
Claudication.
vascular claudication. Because you can bite for a long time without having any pain.
Yes, he can bite. Why he can bite for a long time without any pain?
Well,
is
he's not in
claudication?
the upright position.
Good.
And also, if he had the neurogenic, then he would have pain even biting
Okay.
from the lumbar area. No.
Not necessarily.
The first part you was right. You was
Well,
right.
if he's biting,
So when you bite, what kind of posture you have? The posture is.
yeah,
It's front,
Bend forward,
bend
right?
forward.
forward.
So when it's bending and when you walk up right, what happens? Your posture is
Mhm.
Upright.
right. So that will change the pressure on the spine.
Right.
So people with neurogenic claudication, they bend forward, it will feel them, make them feel better
Mhm.
because open up the pressure on the nerve, especially in the inside spinal cord. So
Okay.
that's why sometimes if you go in the supermarket, you see some old lady pushing the shopping cart
Oh, yeah.
and bending forward.
Yeah,
You guys,
that's
I tell you guys about shopping cart sign.
Mm-mm.
Oh no.
The shopping cart sign.
No.
In the first hour.
No, we didn't do.
Shopping cart sign. So shopping cart sign that people when they have with this neurogenic claudication,
Uh-huh.
they want when they're pushing the shopping cart, they like to lean forward.
Ah.
So or they lean forward like that will make them feel better. They can walk longer.
Yeah.
But if people have if they walk up straight with upright, will hurt them more. The leg will
Right.
Okay.
painful. So when they tell you that, patient come in and tell you that, you know that for sure this is the pressure from the lumbar spine.
Okay. Well, in
Pressure
this
into the
case,
spinal cord.
this guy might have those conditions.
Could be.
Yeah.
Yeah, but it's,
Because,
read it. Yeah, especially when they have a history.
Use pressure onto this way.
Hmm?
Use pressure onto
Oh yeah, has history of high blood pressure and
spinal
diabetes.
cord.
So that,
Can't increase when walking, but
Could
feel better when bending forward.
yeah. But
Bending
then,
forward feel better.
yeah.
So if people have a vascular claudication, you bending forward doesn't make any difference.
Yeah, but he has high
If
blood
he
pressure
has
and
the-
diabetes.
If he has vascular claudication, so vascular claudication that means they have some arterial stenosis, have some artery narrow the blood vessels.
In that
So-
case, what kind of a symptoms we would see with the vascular?
Rest will make it better.
Rest will make
Sit
better.
down, rest will make it feel better.
Okay.
Bending
Alright.
forward, extend backward doesn't make any difference.
All right. So
Okay, so support cut
you
sign.
convinced me.
Support cut
Yeah.
sign. Think
Shopping
for the
cart.
neurogenic claudication.
Mm-hmm.
Bending forward will make them feel better. So people with this condition, they tell you that every time they walk, it hurts. They have to squat it down like this. This make them feel better. Squat down. Or bending like that will make them feel better. I have patients. She said that every time she walks in the supermarket, the leg it hurts. She pretend like she bend forward, look underneath the cell, like looking something like this.
Aw.
Because she feel kind of embarrassed when she bending like that in the front of people. So she pretend like she looking down and look something that make her feel good, so she can walk further.
Too
That
bad
makes
for
me
her,
think
isn't
of-
it?
Huh?
It makes me think of something I noticed long time ago, and I didn't understand why old people they do squat a lot. I see them in the streets, sitting like that,
Put a nice note like
and I
that.
didn't know why. And I just thought,
Yeah.
my God, they must have strong legs.
So-
Now I
In this case,
understand.
no sign.
Okay.
Rest will make vascular coordination better. You
A
will get it.
shopping cart is
Sign.
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 neurogenic.
Yeah.
So this guy has neurogenic claudication. This is interesting.
So I got it.
Mm-hmm.
Yes. I don't know this one, so I think.
But what kind of test? Kind of orthopedic test for this one. Cam test?
No.
Cam is for hip. It's not for the.
Oh no. We should
This
test.
is thoracic. Right arm position. This is thoracic, right?
It will not tell you anything. The nerve, if we are looking at the nerve, they are finishing somewhere. So if we want to see how they react, I think we should look at that. So if it's coming from the lower back,
Mm-hmm.
then from that thing, so we should look at the nerves that are coming from the lower back. Which one are they?
So we need to have a test to see it.
Well, then you check it out for the test. Once you know which nerve it is. Is that? Isn't it? You can help us. We are so like we are supposed to be fresh out of trauma. It's like crazy. So we're just discussing if this is a nerve issue.
Mm-hmm.
So we have to look at what kind of a nerve, or so it has to be indicated from the lower back, isn't
Yes,
it?
one lower back.
And then what kind of a test? So after we know which nerve, then we perform the test toward that nerve, or what will we
The test, for example, perform orthopedic examinations or a special test like MRI. Refer for MRI.
Oh, okay.
So there's no special test for this one. There's no
In order-
orthopedic test for this one.
Orthopedic test, you can do cam maneuver. Sometimes cam maneuver can.
He was right. Okay.
Cam maneuver might produce the positive test because cam maneuver you extend and rotate and extend your back, right?
Right.
So that put more pressure on your disc, more pressure on the nerve root.
So we can, through the MI, we can actually see the nerve compression.
Yes, with MRI. Yes.
MRI or MRA?
MRI.
MRI. Usually when we're looking for some kind of compression on the artery, on the
That's artery. That's angiogram.
yeah.
It's not nothing to do
No.
with this.
Oh, okay.
This is MRA.
MRI.
MRA different from MRI.
Okay. So would we have not gone through how long would we see this patient?
Huh?
We don't have that much of an experience. How long do we have to treat this patient?
This with symptom is mild, moderate. Maybe you can treat with the exercise stretching.
Mm-hmm.
So stretching the back, stretching the core, bending forward, stretching forward. Okay? So stretching the back muscle.
Mm-hmm.
Swimming, pulling up, exercise. Physical therapies can help. Yeah. Walking in the water, you stretching the core muscles. Patient will do better.
Then how long,
But-
how many sessions would you see the patients for?
Maybe about 6 to 8 to 12 maybe. But if after
Depending on-
6 and 12, 8 weeks, if you don't feel any better,
No.
Where is this coming from?
that's crazy. Okay, so now. So after 6, 8 weeks and you don't feel any better, then refer for MRI.
For MRI.
Or it's symptom getting worse. See more in with neurogenic claudication, see more in senior patients. Old people. Or people have have a acute trauma. Young people with acute trauma, like lifting weight. We just have the ladies that came to our office with the student do exercise.
Okay.
She came this morning, actually she came 2 weeks ago. She lifting weight because she planned to go to the police academy.
Mm-hmm.
So she lift weight and she hurt her back. She
Oh.
popped. And so every time she walk for 10 minutes, her leg is numb. She have to squat down, sit down or squatting down to make her feel better. So
That's
we
how
figured,
she
yeah, we
stretched.
figured about 4 or 5 people. Today she's fine.
Nerve claudication.
And then we show her, important that we show her the stretching,
Mm-hmm.
do the back stretch.
So that's nerve.
Yeah,
Compression.
neurogenic claudication.
Nerve.
Bending forward make her feel better.
Yeah.
Mm-hmm.
Bending forward feel better. Squatting, bending squatting down make her feel better. Walk up straight. 10 minutes you have to sit down rest because of the pain, because of the numbness. So only like 4 or 5 treatments here we get.
Because she's young.
Young age,
Yeah.
new injury, recover fast. Old people like people with degenerative arthritis or bone spur. Sometimes it's really tough to do.
And then do we give any formulas or we just do acupuncture for her?
Acupuncture, stretching.
And no herbs actually, no formulas
I
for
don't
this.
know if will help that much. Maybe I will give her like glucosamine,
Mm-hmm.
maybe the omega-3 for inflammation. Vitamin B6, yeah, B12 for the nerve, nourish the nerve.
B6, B12. What else?
Glucosamine.
Yeah, and then
Got it?
What
So,
else?
today you will learn neurogenic claudication, vascular claudication,
Yes.
spleen compartment
What's
syndrome.
glucosamine
Thank
for?
you.
More, there's more case
Just
study
pop
there.
this one.
Oh yeah.
Okay. Skip it. We check it out. Glucosamine.
Okay.
I have glucosamine, but I don't even know what's
B6,
up for.
B12, what else?
Oh, he said glucosamine, omega-3.
Omega-3, yeah. That's
Omega
what it
3
is.
for
Yeah,
inflammation.
B6 and 12.
Omega 3 for inflammation, right?
Mm-hmm.
Oh, 3.
So would you consider, now I'm again going around the herbs, but for this is kind of cute and it's a young woman that it was, so we will not give. But if there is a chronic one, if there's older people, should we consider some formula or not?
Yes, that's what I'm talking. I told you earlier.
Uh-huh.
Supplements.
Supplements, okay.
If you nourish young old age,
Mm-hmm.
with old age and with that degenerative arthritis,
Mm-hmm.
what do you think in Chinese medicine in the diagnosis will be?
Arthritis.
It's
Maybe
muscle.
Wind
Qi and
dumping.
blood stagnation.
Of course, every time you have pain, you have T plus stagnation, right?
Yeah.
But in old age, what is the constitution, what diagnosis?
Wind dumping pain?
No.
No? With
Yeah.
arthritis?
Yes, with degenerative arthritis, so
Degenerative.
dry up the body fluid, right? That's more the yin deficiency.
Mm-hmm.
So in that
Blood
case, a
flow.
liver kidney yin deficiency.
Yeah, all people in the
Yeah,
Liver and kidney.
liver kidney yin deficiency.
Mm.
Yeah, if liver kidney yin deficiency, then what is the formula?
Doesn't know the all people can insufficiency.
We
Yeah,
just
that's
talk about
popular,
it.
yeah.
Liu Wang.
Yeah.
Liu Wei, yeah,
Liu
Liu Wei
Wei.
different one. Yeah?
There was just one that I got for one patient.
How about a patient have a deficiency with the heat? Like people, women go through menopause
Mm-hmm.
and they have a heat
My
sign.
I just use last time.
G body hormone.
Yeah.
How about 2x-D11?
Yeah, G body hormone.
Mm.
So Liu Wei plus Ju Mu and Huang Bai. Then you have G body. You guys learn those formulas?
Mhm.
Yeah, we did.
So that's this empty heat. Right?
But we never practiced.
So that formula is good for people with the postmenopause,
Mm-hmm.
with the woman with postmenopause, with the hot flash,
Hot flashes and
irritable, night
yeah.
sweat,
right.
yeah, feeling also heat, anger easy.
Mm-hmm.
So that's the nourish the yin or as a center of clear the heat, especially Ju Mu and Huang Bai. So Liu Wei plus Ju Mu, Huang Bai. Okay. Case study number 3.
Yeah.
48 years old, female,
Blood compression.
distance and noise for a month. If she can, okay. Vertebral basilar insufficient test.
Right on.
What did you say?
He said vertebral basilar
Insufficiency test.
insufficiency test. It's she has a decreased blood flow to the head.
Yeah.
So when she's turning,
Right.
she's having she's
Stenosis.
compressing this, and then basically that's why she feels dizzy. So that's the test we will do, and that's the what's the condition?
I think she
And
has
nauseous
nerve
and
compression
dizziness.
here.
No, not nerve.
Nerve
In this case,
compression.
this is a blood
Oh, blood flow. Okay.
blood flow that is wrong.
But it was caused by
Stenosis.
whiplash.
What?
Whiplash.
With blood accident.
She
1 year
had
ago.
whiplash.
Oh.
Oh,
After the accident, she was
she
okay.
was okay.
A little pain on the neck, and pain went away a few days later. She would feel dizzier if she ate. Yep, that's.
Feel very. I mean, honestly.
So when she eats all the food,
It's stenosis, so she
Yeah,
has stenosis
stenosis
in
in
her
the
artery,
Mhm.
neck artery. So basically, that's the causing.
BBIS.
What?
Good, huh? You guys remember from what I talked about?
Yes, that's
Yes,
from the
that's
last class.
Very good.
Ah, at least something.
And that's it.
Ah, yeah, that's good.
Okay, we know the test. Diagnosis.
You guys learn that condition in your regular class at Vertebral or no?
No.
No?
You can't say no to everything.
Just say no to everything so we can review.
Just say no to everything.
Yeah, so we can review. Artery in the blood.
Do you remember this test from the advanced trauma neuropain we had?
Well, he talked about passive and active.
That's when you're indicating is it a muscle or
When he held somebody's head and
Yeah, but this one is just, this is actually active range of motion that you're doing. The patient is doing by itself.
Right. Yes.
Or you can do it. Yeah, you're right. Or you can do it. You know,
The
you
doctor
can.
can do
Yeah,
it.
you can turn it and then see if he's or patient's feeling dizzy
Yeah.
or something. So you're right. Yeah.
So
You
we do
do-
active and passive.
Even just one can be.
I
But
think the passive. I think
yeah.
passive is better
Passive or active is still show it.
Yeah.
because the practitioner is holding the head, so he knows how to turn the head without hurting. She might, I don't know, she might do it wrong or something. I don't know.
I remember that we should not do tuina or anything like very.
Oh, yeah, because it could
very,
cause stroke.
It will cause a stroke.
Yes.
Yeah, and
Oh.
we,
Not very strong
Yes.
motion.
True. That's the
Me?
Me?
chiropractor.
Why should I?
Mm.
Okay.
What?
He wants me to ask.
About what?
Is it true?
Oh, that's the
I think
from the chiropractor perspective.
Mhm.
The adjustment at the neck level could cause a stroke.
GB20,
Yeah. That's true.
21, GB10, Basilar.
UV.
Oh, UB10.
Yeah, UV.
And by now.
You got all the points.
Okay.
Yes. Is that GB10?
A UB.
And which imaging we will go to?
Imaging.
Center.
CT?
MRA.
Oh, MRI.
How do you do MRA?
You don't do.
No, but how does that test? How do you do that test?
They put the fluids that it's and then
A
the
dye.
color, yeah,
Yeah.
the different colors. So it's like
Will
it's
show the
making
blood vein is narrow.
vein or artery.
Yeah.
Usually it's artery.
Dr. Frank, is the MRI MRI part of nuclear
MRI.
medicine? Is nuclear medicine or no?
They also, yes, they inject some special
Right.
dye.
Is
That
that
is-
part of nuclear medicine?
It
Nuclear
is.
medicine, yeah, it is.
Because it's actually after that they imaging and it actually a different color shows absolutely, you know, it's almost
Right.
like radiation
Right.
of the different colors. So
Right.
yes, those things are really
Uh-huh.
observed.
Yeah, it's like this. The same liquid they inject. They give you a pill to absorb or something to see the thyroid.
Oh
thing.
yeah, yeah.
And that way
Mhm.
also shows the.
So I
It's
just don't know
nuclear
how it's
medicine.
been injected.
It's
I don't know
nuclear.
that,
Mm.
but I know that it goes to the artery so
I
you
see.
can
Yeah.
make an imaging out.
Uh-huh.
Yeah, it might
So
be
what
very-
is the practice? I mean, what is the exercise or stretching to help this patient?
There's no there's no
What, swimming?
exercise
How
for
do-
this.
Swimming?
This is internal
neck.
issue. You
For
don't need
neck?
exercise.
What kind of exercise would we do for
I
this?
wouldn't do any exercise for this lady
No,
because
avoid.
she's
Avoid
Dizziness.
rotational, yeah.
No?
Avoid excessive cervical rotation because that can cause a stroke.
right.
Why is that causing stroke if you're doing any kind of excessive in the cervical?
You tell me why.
No, we were just thinking because it has to be a blood clot that will make a stroke. So does
That could be one thing. Second thing, like remember,
Lack of blood?
sometimes they have a facet, right? The facet joint. You have the spur, and that spur can compress on the artery, especially when they turn in the neck.
oh the spur? Okay.
So the spur can put pressure on the artery.
And then
So that
Oh.
can damage the artery.
Mhm.
Or when you turn and when inside is the blood so narrow already, it will reduce the blood flow to the head.
Mhm.
But
If you
does the
prolong that,
but-
if you prolong that,
I thought that
That's true.
reducing of the blood of it will take like it
3
will
to
get
5 minutes.
Wow.
Usually 3 to 5 minutes, your brain will
Oh, and then it causes stroke.
That's it.
your brain.
it's going to be die, but that's not really a
The blood
stroke.
vessel can rupture. The problem is it
Oh.
rupture.
Oh, the rupture of the blood
So
vessel.
when you compress
But how
on-
come it rupture usually when there is a pressure? But this,
Aneurysm, you mean?
yeah, but that's
Aneurysm.
usually when there is a pressure in there. But this way we are blocking a blood flow, so we have less blood in the brain.
That's
So
considered
I'm trying to get
that's
the
ischemic
mechanism.
stroke.
Uh-huh.
Ischemic.
It's ischemic.
Oh,
blood.
so the blood vessel actually dies because it doesn't have
Blood cannot flow.
blood is not flowing, so it dies. It dies out. The nerve and the
Blood cannot flow.
You're right.
So it's like 3 to 5.
Shamikwan.
So I guess there's.
Some people do excessive maneuver, like when they do the, they want to do chiropractor and get adjusted. That adjustment can damage the blood vessel.
So can it happen they have stenosis stenosis of the artery and the spur in the same time?
Maybe. Could be.
So what would we refer them to first? Should they first go to
Neurologist.
check? Always neurologist first before
neuro-
getting to.
Neurologist or cardiologist. They can
Mhm.
order the MRI.
So we don't need them first. We send them out
That's
first.
amount, yes. And they do the procedure that they go from the artery, from the
Or from
femoral
there,
artery,
okay.
go up, and they take the picture.
Do you refer these kind of patients systematically to a
Yes.
neurologist?
Yes, either neurologist or cardiologist.
So we don't have I know that we can order some
It's
labs,
a rec
but
lab.
Yeah.
we cannot
Okay.
order those labs by ourselves.
Otherwise,
So I know that acupuncturists can actually order some labs and imaging. I'm not sure that
you cannot order a blood test.
we cannot. We do.
Yeah.
Yes, we
You see
do.
on the referral exam, blood exam in here is under my name or under Dr. Allen Watt.
We can't.
I
The
actually.
referral form.
I went for some clinic and then they give me to go to a Quest, but like she
Yeah,
signed up for
sometimes-
her.
Yeah.
I think we do have a authority to send for a blood test. It's one of the thing that if we can. And I was in situation where I honestly don't know. Maybe she has some other degree besides acupuncturist.
Possibly.
This is something that I don't know. But I was in acupuncture clinic and she ordered the blood test for me. And then she signed like acupuncturist at least.
No.
If she's acupuncturist,
But
she
I
has
saw
to
an
be-
acupuncturist and she told me that she cannot. I asked her to give me.
Yeah, the law.
Yeah. She said she can't.
Well then.
You ask your.
Maybe it's
I think
my
you take,
wrong.
You guys take also the class they call like
Law,
case
right?
medicine. Remember?
Case medicine.
Western case management.
Western case management.
Yeah, you ask.
Dr. Wong.
Dr.
Yeah,
Wong.
we can
I
ask.
don't know, or you ask the.
Let's ask Anna.
That's another one, the one that doing the.
I think Anna was saying that we can.
No, that's another class you guys doing all the ethic, all the.
Oh, professional ethic?
Yeah.
And
Law
then
and red, you are doing Jenny.
Yeah, they might know. But I know.
yeah, I'll ask. I'm in the assessment too.
X-ray, MRIs, yeah, sometimes they don't care, they take it.
Oh, okay.
And you get an X-ray, MRI, some place they say that you have to be an MD, DC, or DO to refer out. But like in Santa Cruz, we refer 5 branches in Santa Cruz. In the past, we refer to clinic out to have a X-ray, MRI. They never accepted.
Oh, interesting.
But here, Frank, he refer out for people who have X-ray, MRI, no problem. Some other acupuncturists refer out. You refer them, they get money.
Yeah, exactly.
They get
They're
more
not
money.
supposed to, that's against the law, actually. But,
Yeah.
yes, it's against the law
like
to
it is.
have,
I like referring.
Right.
yeah,
It's
you
like
can't
perks.
get any.
No,
money
they
for
don't.
the
You don't
referral.
get any, but you refer to that clinic. That clinic, when they perform the service, they got money. No,
That's
not
true.
Kickback
Oh,
money.
okay,
not
yeah.
kickback like you refer,
I
they
thought
give
like
you
it's
money.
this
No,
one,
no,
huh?
no, that's a kickback. That's considered kickback.
Yeah, that's very bad.
You'll be big trouble.
All right, so did we solve this case good? Dr. Fu, finally?
Yeah.
Third case, we're
Good job.
good?
What?
We're good at this third case?
Right
yes, you
arm
good.
and pain,
Okay, let's,
numbness.
we're at 50, we're at 4 already? Don't go so fast. Take your
We
time
don't,
on
have, we
patient.
don't have time.
Yes, we do.
It's 2:20 already.
Yeah, but we only have 2, come on.
Okay. The pain and numbness after working here.
Okay, so this is what we talked about last time.
Patient feel better.
Mouse and
The mouse,
computer
yeah.
thing.
That's right. Oh no, simply the numbness continued after working out.
Oh, barcode design.
Mm-hmm.
Yeah.
basically, what could it be?
Cervical.
Yeah.
No,
That is the
there's
nerve root.
one. No, there's one.
But there's no indication. Wait. Put more arm down. Right thumb and right index finger. Right thumb, right index finger. C6. C6.
That's C6, yes.
Yeah.
What can it be?
C6.
C6 is this one.
Yeah, but what is that? Is it thoracic outlet syndrome or no?
No.
It's not.
No. It's not thoracic. Look at this one. Nerve root irritation.
Yep.
Nerve root irritation.
When arm up, it relaxes the brachial plexus. When arm down, it stretches the plexus.
Plexus can be with thoracic outlet syndrome as well.
Thoracic outlet syndrome.
It's because thoracic outlet syndrome is doing
Puffy hand. See?
whole hand, but there's a difference.
Arm up for 30 seconds. Arm fatigue and down. Weak and tingling arm.
Oh yeah, that's different. You're right.
Yeah, Bakodi sign.
That's Bacody's sign.
How do you write that?
Huh?
How do you write it?
Bakodi,
B-A-K-O-D-Y
sign.
That's and then he says which where's my case study? Where does it go?
Bakodi sign.
I think you just did my
Huh? Oh.
yeah, you did.
So the diagnosis is when arm up, it relaxes the brachial plexus. Arm down, it relaxes. Okay, for the treatment plan, we're gonna have the same.
Elbow and feet.
So which nerve is it? C6, huh?
Yeah, it's a C6.
Then have to do the SI points here up the shoulder.
Give me 1 second. I'm gonna call it. C6.
Cervical irritation. That's the name, huh? Cervical nerve root irritation.
So I think we will do GB 2021 again.
GB 20 and 21.
Yeah, GB 2021. And then UB 20, UB 10, sorry, bilateral. Wait, bilateral as well.
Extra.
Where?
Mention some points up.
Belly shoulder, small intestine. Yeah, so for shoulder we have a Basilar.
Here. It's above the 240. For one nerve.
One
Wait,
lateral.
Tutsum above 214. It's the Basilar.
Okay, wait, how you look at 214? Show me.
214 is where the C7 is.
Oh, at the end of C7.
Or right on top of it. Between C7 and C6 or between C7 and T1?
So if this is narrowing, so it's going like vertically or obliquely for this point?
Let's see.
Perpendicular.
Perpendicular. But it doesn't go too deep.
So a little bit. Okay. Half inch. Half inch or half done.
Oh, here it says half inch, but
Oh.
I don't do this. Inch.
We did the GB21 you last week, right?
Oh, yes, we did.
Yeah,
That's why he feels so good.
Any treatment plan? Yes, we have treatment plan already. Any exercise for this one?
He should stretch as well.
Oh, remember?
Mm-hmm.
Yeah.
What is
That
it
one
called?
was for
I don't know
here,
what's the
for
name
this
of it.
area. That one's for this area.
It looks like a model.
Oh, yes, you're right. That one is for.
Like a model.
No, actually, that one is for your shoulder when you do computer too much.
Well, he's working over the computer, so that will help. Stretching will help.
Oh yeah, that's true.
I'm not sure with other.
So what do you call that?
We will call it model. London model.
Exactly.
Okay, actually we know it. Okay, let's move to number 5.
Model London. Okay.
Truck driver sit a lot. Running pain and numbness for 2 weeks. Injury next week. So no acute.
Call. Mm.
So vertebral.
For number 4, didn't he say to do some pressure here? So to strengthen these muscles here, and to do also pressure in the back
Like
for these ones.
to do this, like yeah, I do remember like doing this.
Right. Yeah.
So what do you call that?
It's just to help out to get involved
Backward.
these muscles.
Backward stretching your head.
I don't know.
Strengthening.
How do you
I
call
think
it?
strengthening the neck muscles.
Strengthening
Yeah,
the neck
strength.
muscle.
This guy has sciatica.
Pain sitting too long or keeping his right leg. Feel better when lying down.
It does sound like that.
No?
I said it does
because
sound
he
like
sits
that.
too long. He's a truck driver. Sits too long, and also he's got his leg engaged.
So when he sit
Yes.
down, when he lay down, he feel better.
Yeah.
Sciatica is going over here,
Uh-huh.
so it's gonna be a hip.
Down.
So that is a hip test, right?
Yeah, what kind of a test?
Yeah, his
Hip
leg.
test. Can test again? Or Patrick Faber. I think it's Patrick Faber.
Flexion.
Flexion, abduction, external rotation.
Oh, maybe
So
when he lays
like
down and
this.
just take the leg and
Yeah,
and
then you move it.
like this. Yeah.
Yeah, you
In and
move
out,
it. Yeah,
yes.
in and out. And then it will compress onto your hip over here. What is that? Wow.
Well, when you were rotating it in and out, you're also looking for the psoas here to see if there's any,
Pain in the.
Yeah.
Mhm.
in the groin.
But it can also, not just the groin, it goes to
Yeah.
this one. It depends where you rotate.
Right.
If you rotate toward
Mhm.
inner, then
Yeah.
you will engage this
Yeah.
muscles of the hip. So it basically, you're gonna feel, and the sciatica is actually going from here. And there's a pisiform syndrome that's go inside. That's one small muscle.
The psoas. Psoas.
Is it called?
Yeah, that's the psoas. Because my daughter plays soccer, she always injures the psoas. So that's how I know about it.
Not good.
Yes.
Can you use spell words?
PSOS, and then pisiform is like the right name of the muscle, is it?
Mhm.
Pisiform. This one, there, that connects hip with the.
Mhm.
Okay, so what should we do with this?
Okay, the first thing we have to figure out what test. Patrick Faber?
Yeah, I think Patrick Faber is the best.
Patrick Faber. Is the mechanism, diagnosis. What
Oh, he asks for
what is the diagnosis?
PCM. He asks for PCM.
No, what kind of mechanism for this one, diagnosis? So you sciatica, right?
Yes. That's the diagnosis of sciatica.
Yeah. that one doesn't go like GB30, I think.
Is it GB30 or is it UB30?
Or GB30 is the
That's right
middle of
under.
third of the.
Oh, but there's one that's right under the box.
That's
UB 23, 25, GB 30 are ship point.
oh, so it's all.
Go slow.
Well, UB 23, 25 is it's a little bit up, isn't it? It's in back show points. UB 40 is a knee. UB 57.
That's behind the.
40 is behind the knee.
Oh,
Yeah.
40
It's 57. I don't know where is that one.
Yeah, I don't
Let
even
us check.
remember where it is.
34, 39. That's fine.
GB36.
I like it. Very straightforward.
Mm-hmm.
Send point.
So, what do we recommend this guy to do? Stretching? Don't put his wallet on his back pocket, for sure.
Well, it's a right leg and he's a driver. This is repetitive thing that actually lead him to.
So he feel better when it's laying down.
Yeah. So he has to go, he has to change jobs.
Has to ride a bicycle. Go from truck to bicycle.
You need to sit down and stand up
Are you
more
done with
often. That's it.
What do you think? What do you think it is?
I'm fine. Still
Oh, you're
has to-
fine?
Yeah.
Oh, 57 is here where it is. It's like the middle of the calf.
Yes.
57.
Oh, yeah, where the two muscles.
Oh.
It's the middle of the calf.
Yeah.
I totally forgot. It's not very
So
common.
these
It's
are
all
all, these are
Actually,
all local
I
points.
have seen Sean
doing this one.
doing that one for a guy who had, what kind of pain did he have? Oh, his calf was compressed and he had lots of pain here.
Oh, like cramp?
Yeah,
Oh.
yeah.
Okay.
And then when he did it, the muscle relaxed. And
Do we have to each team every time we use all those points? On
We did not each team
GB57.
it.
Not necessarily.
But we
It
can,
depends.
right?
yeah,
Yes,
we can. And the guy was so happy because he could walk. It's magic.
Oh, great.
GB34,
It's okay, we only
Can
work
I-
on- Yeah.